Welcome back. Today we're diving deep into the world of natural remedies for arthritis. If you have pain in your joints, if you have any swelling, inflammation, if you have fatigue, this video is for you. I'm Dr. Banasali and I am a rheumatologist, a specialist in inflammatory joint disease. And what I see all day is pain. Pain in the joints, pain in the tendons, pain in the ligaments. How do we help these? We have a lot of medications nowadays and some of them are very effective. But at the same time, natural remedies have been there for a long time. Some of them work, some of them don't. So I think it's time to talk about them and what is the evidence. First, let's differentiate what is inflammatory arthritis. So if you say you have hand pain, for example, and the entire hand is swollen, it may not be inflammation in the joints. That's different. That would be just one area. Maybe it's this one, that joint, or maybe it's the third joint right here, maybe it's the fifth one, but it's not usually the whole hand. So it's important to differentiate because there's different medications and treatments for various ailments that you might have. So if we talk about inflammation in the joints, when you have pain, you have arthritis, and what are the effective natural remedies for that? One of the ones that's been shown to be promising is turmeric. It's this very yellow spice, and you don't want to get it on your clothes because it's hard to come out. It also can stain your fingers, but it has a lot of healthy properties. And one thing that we want to show is the evidence behind joint pain. You've probably heard the term turmeric more often than you've heard of curcumin. Well, the active component within turmeric is actually curcumin. So that's what you really want to take. Curcumin, also known as turmeric, has been turning heads in the health world. And we know that extensive studies have shown its benefit in osteoarthritis in terms of improving the walking distance and reducing pain, but it's also showing evidence in the world of inflammation in the joints, inflammatory type of arthritis, such as rheumatoid arthritis or psoriatic arthritis. In America alone, over 1 million people have rheumatoid arthritis, and about half that amount have something called psoriatic arthritis. My team and I did a study amongst patients who have rheumatoid arthritis and psoriatic arthritis, and the benefit that they felt when they were taking curcumin or turmeric. The evidence for efficacy of curcumin in rheumatoid arthritis is pretty low. There's been limited randomized control studies showing if it can improve pain or stiffness or fatigue or anything else. And in psoriatic arthritis, there's even less studies regarding curcumin or other spices and how they could help. Although the studies are looking pretty favorable in animals in terms of reducing inflammation, but not yet with human studies, because they just haven't done them. So what did this study teach us? Well, first of all, that there's a growing amount of interest in people who have rheumatoid arthritis or psoriatic arthritis to find natural remedies that could help their pain. Doctors know there's medication for it, patients know there's medication for it, but sometimes those medications don't take care of all of the pain. And if you have a lot of medications on board, you're looking for ideas on how to reduce the amount of medication burden you may have in your life. So you're looking to other alternatives like spices or supplements. Curcumin, we found that almost 50% of the people that responded in this study said that they had a positive outcome with it. They felt that it reduced pain, it reduced stiffness, and it reduced fatigue. These results suggest that curcumin could be valuable as an adjunct treatment for somebody who has inflammation in the joints. So they could take medications, but they could also take the curcumin supplement. You have to be very careful with supplements though. So this is the powder, and you can sprinkle it on food, and for the most part you don't have many issues with that. However, there has been suggestions that even the powder form is possible that it's not pure. I know when my mom would get it for me that she would make sure that it's from a very reputable source before she would give me any for cooking. It does matter, unfortunately, where you get it from. How much curcumin should you take? So this is very different whether you're taking turmeric or curcumin. For example, the average Indian diet has a lot of turmeric in it. It's a spice that's commonly used. But if you look at the diet, it's about 2,000 to 2,500 milligrams of turmeric in the diet is used in a day. But if you look at the active component, the curcumin, only about maybe 50 to 100 milligrams of curcumin is found actually in that diet. So you could eat with it, sprinkle it on your food, cook it with your food, and that's also a wonderful way if you want to just kind of incorporate it in your daily foods as a spice that maybe could help. But if you're taking it because you really want to see if it helps your pain, then you might need to take a supplement, a curcumin supplement, and an extract might be better. Hopefully it's more pure than just a regular supplement that you're going to get from the store. But safer doses have been shown to be about 500 milligrams, but even up to 1,000 milligrams a day of curcumin. And some people go up to 1,500 milligrams as well, but the studies are just not great. They're not vast, they're not on humans, and they're not long. So kind of the least amount that you need in your diet, because there are potential side effects. Some people, it bothers their gut, or maybe it helps your blood pressure and therefore your blood pressure goes too low if you're taking medications also. So the bottom line here is if you have arthritis or pain in your joints, and let's say you have degenerative arthritis, well, you might still need to take anti-inflammatories or acetaminophen, Tylenol, but perhaps if you use spices or other factors in your life with lifestyle medicine, maybe you can reduce the amount of pill burden that you overall take and feel better. If you have rheumatoid arthritis or psoriatic arthritis, you can also have degenerative arthritis. But even if it's just the inflammation, and let's say you're on a biologic medication, you're on a disease-modifying medication, you're on an anti-inflammatory, you're on steroids. Yes, you may need all of those things when you have a very active inflammatory process. But you can also look at other ways to improve that inflammatory burden and maybe use less medications overall. So there is benefits to looking at other ways to improve your life. Whether it ends up being turmeric or something else, it's definitely worth thinking about. But I would caution one thing. If you've been prescribed several new medications and your doctor wants you to try them, then it may not be the best time to introduce a new supplement, because you want to introduce it when everything is steady, when you're on a steady regimen of medications, or you're not. You want to introduce it then so you can see if there's any potential side effects, any issues with your blood markers, any issues otherwise. You could have stomach pain from it. It could increase your risk of kidney stones, blood thinning effects, because it can affect your coagulation in your blood. So surgeons don't want you to take it before a major surgery, but also if you're on a blood thinner, it's not a good idea because it could potentiate the effects of that blood thinner. And so there are times where you want to be careful with using this supplement. Of course, every case is different, so you should talk to your doctor about it. But overall, for curcumin supplementation, most of the studies that are shown, and we still need way more, we need bigger studies, more in-depth studies, human randomized controlled trials. But until that point, you could try lower doses of turmeric or curcumin supplementation and see how you do with it. I always encourage writing notes, having a journal to see if there is an effect, because why would you take something if it's not going to help you? So you can try taking it, take it consistently for perhaps 4 to 8 weeks. And if it is not helping you, then stop it, because you also don't need to be on anything extra that is not helping you. If you're taking it as a capsule or a tablet, then it's important to get it from a verified source. If you get it online, then make sure there's tons of reviews. Make sure there's thousands of reviews on it, not the one that has 2 reviews. You don't want that supplement, because you want to have a quality one that it's not cut with lead or anything else. Right now, there's a lot of data that's going on about spices even that have contamination in them. Make sure if you're going to use it that it's a quality supplement, a quality powder. Make sure that it's quality. So basically, curcumin did improve patient-reported outcomes in those that were battling inflammatory arthritis. And there is more hope that a holistic approach or an integrative approach could help with managing something like inflammatory arthritis. What can you add curcumin or turmeric to? Almost anything. Well, at least savory things, but even some sweet ones. If you enjoyed this or learned something from it or think somebody else could learn from it, then let them know and send it on to them.